we're reading up on each other. It's like Elena Rivera-Cheek was looking at your profile. Tyrone McClain was looking at your profile. Got it. Welcome to Inside CNA Digital, the podcast. You are in for a great one today. So today we have Tyrone McClain, who's Senior Director, Public Affairs for Inflammation and Immunology at Pfizer. That is a big title.
Sure is.
I am so happy to have you here. I think even bigger than the title is the person and the man before me. So I can't wait to have our guests learn about you.
Welcome. You for having me. Thank you so much for having me. I'm really excited. I got to see your interview with Nate, and it was really phenomenal. So thank you for inviting me to your platform.
Yeah, I think one of the blessings I have is I have really cool friends, and they're really cool friends of friends. And there is so much that I want to unpack with you today. There is a lot of synergies between like the work that you do at Pfizer and what you have dedicated your life to that we're going to kind of get into. That's really intriguing and impressive. But why don't you start by telling our audience a little bit about you, your background, and kind of what you do today?
Yeah, so thank you, and I'm really looking forward to this conversation. A lot of things that I do is just guided by what I consider my North Star and my values, so I'm happy to get into that. But, for those who don't know me, I started out my career out in politics. So for me, it was more or less like giving a voice to the voiceless and giving back to my community. Growing up with a single mom, had me at 16, there was a lot of things I had to learn how to advocate for myself. So that took me down the path of politics, giving back. And everything that I've been doing is like, how do I build up the community? How do I give back to the community? Because it's always about paying for it. So if it doesn't fit with my North Star, the values that I care about, it's not a job that I got to wake up and be happy about. And then I'm really blessed working for Pfizer. I mean, I have a really awesome job, and I'm able to make some real positive change with partners. So,
yeah, that's amazing. So tell our audience a little bit about what you do in your role, specifically what you're in charge of and what goals in your position look like.
Yeah. So again, my role is really cool. So what I do is I sit on a government relations team, and in my role, what I do is I partner with the business to identify what are the barriers to access from patients getting treatments and reputational issues. And in order to do that, you have to have an eye on policy, but also more importantly, really important cross-functional relationships internally with market access, a government relations team, medical, but also more importantly, external partnerships with patient advocacy groups and professional organizations. Without them and amplifying their voice, a lot of the work we do doesn't matter if the patient voice is not in there. So I get to really think about strategies, be creative strategies on how do we raise awareness on these policy areas? How do we insert, the patient voice into these discussions, and really build out really cool partnerships with this too as well. So it's a lot of fun. It's something that I didn't think that I can do because it's not a job I heard about, but a lot of my skill sets align with it. And also I just love people too, so.
Yeah, we have that in common.
Yeah.
I'm a people lover. So interestingly, when I was in college, one of my 3 jobs was I was a tech at a pharmacy, and I was a really curious tech. I used to drive the pharmacist crazy because I'd be like, what does this drug do? What does this drug do? And he's like, you're not going to do this all day.
Yes.
But one of the things that I realized was that certain people paid more for medicines than others, the same medicine. And I was supremely curious about that, which we know is kind of market access, right? And so I've dedicated my career, and how I started in advertising was around market access. And you approach market access, but your avenue is a little bit different.
Yeah.
So talk to me about your commitment to and what that means for people who are not in the space like we are.
Yeah. So, I'm definitely looking at market access, but in my job, I'm looking at strictly from the state and federal level, just from a policy lens, right? So I'm looking at any policies that might inhibit, a patient or a physician from getting the necessary treatments they need. So for example, one thing I just throw out there is like step therapy, right? With step therapy, normally what happens is in order for you to get your treatment, you have to take one to go through, right? Is that always the most effective thing? And also when you think about, innovations, the innovations coming to market, the time lapse that some of these patients have to go through to get these treatments can be detrimental to a certain degree. So that's a lot of things that I work on, just in general, just to make sure, because one of the amazing thing is not only, you know, innovations, but also the quality of life that like some of these patients go through once they're able to get these treatments. Like, how could you not get excited about that and get up and just do the best you can every day?
Right. And if you're not excited, I think one of the things that, you know, step therapy, right, we all know was created to kind of step you through these cheaper drugs first, right? These generics first, or these cheaper drugs. And it was a cost containment strategy. Yes. But it does have an impact on patients' lives. And, you know, today, you know, I'm not always met with the best feedback in terms of having such a stronghold in pharma. But interestingly, if somebody's family member has a condition and they need help, right, what are they looking at? They're looking at that R&D. They're looking at that innovation from folks like Pfizer that are in the labs and trying to come up with new therapies for patients that may not have options. So I don't know. That's pretty cool to me.
Yeah, I mean, and to your point, it also becomes incredibly frustrating on, you know, patients and caretakers, and because a lot of things that they don't know when it comes to how these treatments are be able to access and things like that. So a lot of times I feel as though when I'm at home, my family members have a lot of questions about access and what I do and how the treatments come to market. So I have those conversations. But one thing I did learn from politics is that I'm not here to convince you. I'm not here to debate you. It's all about choice right there. But it does get a little frustrating with some folks that I have to, you know, even in business school, one of my professors, out of the blue, we were in class and we were talking about, it's a finance class. And out of nowhere, he was working on something and he goes, by the way, pharmaceutical industries are greedy. And I was like, wow, that's really interesting. Yeah, it's really interesting. But I took a step back and I realized, you know, where you sit is where you stand. So I don't really know his experience. We didn't have enough time, but that's a lot of the stuff that I have to deal with in this field.
Oh, sure. Yeah. As an agency that has a stronghold marketing for and communicating on behalf of pharma, we hear it a lot too. But at the end of the day, I think you have to stand true to what it is that you're called here to do. And one of the things that I like to kind of give our viewers is kind of an inside look. That's why we're inside CNA Digital and our friends. Like, what is one of your favorite parts of what you do? Like in terms of thinking about your story and your life?
I think a couple of things, right? So one is seeing real change in real time, you know, when patients are able to access treatment and seeing how their quality of life change. That's awesome. I think another thing I really like is, you know, building and sustaining relationships with patient advocacy groups. I mean, it's very important that we have those relationships because the amplification of their voice, but also a lot of times they become your friends because you're in the trenches together working on this. And I would say the last thing I really enjoyed about my job is that everything I do ladders up to the broader picture, right? And the broader picture is to make sure no patient is left behind when it comes to accessing treatments and care. So those are the things that I love about my job that I get to do every day.
Absolutely. One, it's interesting because if you think about inflammation and immunology, right? These are conditions that typically don't go away. So like I know when I was reading up on, you know, your history and some of what you do today, you know, alopecia areata is a really kind of devastating condition that I have. And it is something I've suffered with for 20 years. And, you know, when you think about a lot of the conditions that fall under like eczema or alopecia, you know, these are conditions that are pervasive. They affect people's quality of life and they don't typically go away until there's a cure discovered. So, I mean, I think one of the things that it occurs to me though, is you mentioned advocacy groups a couple of times. Now I know what that means, but maybe our audience doesn't. So, you know, to the extent that you are kind of partnering with advocacy groups, kind of tell our audience what they do, what role they serve, and, you know, if they need help, like how does that work?
Yeah, so taking a step back, in my portfolio in inflammation and immunology, I deal with barriers to treatment around autoimmune conditions, right? So in my portfolio, it's alopecia areata, atopic dermatitis, rheumatoid arthritis, Crohn's disease, and ulcerative colitis, right? So those are in my portfolio, and what I do is in each therapeutic area, there's groups that you work within there. So you have Crohn's and Colitis Foundation, you have COGI, you have Autoimmune Association, and you want to work with them because they're leading the patient voice on this issue. They're out in front, right? And most of the time, even in my background, working for a member of the U.S. House, the first thing I'm gonna say is, have you talked to X group? Where is X group at, right? So it's very important that, we have a great relationship, but we walk in hand together on these things. So that's how I typically work with patient groups, and it's, through funding, it could be brainstorming, it could be a couple of different kinds of ways depending on the issue.
I think it's important because I think when people think about pharma, they're always thinking kind of either direct to consumer or direct to HCP, and they're not thinking about, kind of government players and those stakeholders or advocacy groups or, kind of commercial payers. And there's a whole kind of business around this that each stakeholder really needs the information they need. What are the biggest challenges you face in your role?
That's funny. I can tell you two off the top of my head. I was in the car thinking about.
Good.
One is funding, right? I don't have unlimited funding, right? So it becomes challenging when you have new and emerging groups in these therapeutic areas that you might want to support, or even current partnerships that you want to build out some of their capacity, but you can't, right? So that becomes challenging. But what I try to do more often than not is I try to find other ways to work with them. Like, so for example, I had a patient leader reach out to me last week, and they were asking me about advocacy. So we talked about advocacy, some things that worked for me. We brainstormed some ideas, and I also offered to make some connections there. So that's one thing I try to work through. And then another thing is what we're doing right now is just messaging, right? Making sure you're meeting people where they at. I think every community and every community needs something different. So it's really just keeping that in mind when I go to these different places.
Yeah, that's really important. And budget's always an issue.
Budget's always an issue.
Budget's always an issue.
And I get, it happens, and I have great relationship with my stakeholders, so it's just honest. Hey, I want to help you, but I can't. Maybe we can come back. So, but
yeah, and I think there's also this other conversation around the difference between cost and value, right? So
true,
right, or budget and value, and so you might not have the dollars, but you have the value in terms of your expertise and your connections and how you can support in other ways. Yeah. Now, it looks to me like you've won a couple of awards, which in the pre-show you were like, I don't really want to talk about this. But I want people to know, you've done great work. You've been recognized. It's not the easiest thing in the world to do great work and be seen. So you've been seen. Yeah. So tell us a little bit about what you've done, what you've accomplished, and some of the awards that I know there's a Get to Know cohort, Game Changer Award. Yeah. I know there are a lot of other things you do. Tell me about it.
Yeah, so it's funny. I have a hard time just talking about that stuff. I mean, my wife was yelling at me earlier today. She's like, you got to do more. I'm like, well, I'm not motivated by it. That's not the reason. So it is nice to be seen. It's nice to be recognized, of course, but that's not why I really do the work. But, a couple of awards. So I would just start with maybe the Get to Know You. I think that was really special to me. So what the Get to Know You program was, it was a program sponsored by Sally Sussman and her leadership team. And what it was, the opportunity for new and emerging talent that was new to Pfizer that leadership team should get to know, right? And once you got accepted to the program, we had professional development, but also we had to work on a project. And at the time when I got selected, I think I was doing a terrible job at Pfizer because I'm just so critical at myself. I think I had a huge learning curve. So when I went into the program, it was great to get to know some like-minded people who were going through the same challenges. So I was able to balance that. Also, it gave me the opportunity just to get to know the leadership, and I ended up getting a mentor out of that. So that led to, great visibility, some networking, but also helped me prepare me to go back to business school to make that push to get promoted. So I think that program just really did an excellent job for me to say, I can really make this work. I belong here. And I also got to work on a cool little video project. So
that's very cool.
On my little communication skills trying.
I like it. I like it a lot. Well, it's interesting, right? Because we can talk about awards and not wanting to talk about them, but sometimes awards are when they do see you, it enables you to move forward toward the other things you're trying to accomplish. So, talk to me about your mentor-mentee relationship, like at Pfizer. What are the other things you do or have done that are important to you that way?
So for me, as I started, having a single parent, mother had me at 16, sister at 17, with a lot of responsibility, not having a dad around, there was a lot of people in my community that really reached out to me to make sure that I'm okay. And the only request I was asked is that when I get in position, make sure I pay it forward and do what I'm supposed to do. So that's like my creed right now. So I spend a lot of time mentoring people in Pfizer or even people outside of Pfizer. I have a friend of mine that's in politics that I met through somebody who's like my uncle. He's the state chair of the NAACP, and it was a young guy who came into town that was new, who was into politics, and he introduced me like 10, 15 years ago. I still talk to him every day, about how do we get better? How do we strategize? What you should be thinking? How do we prepare? I just think that's so important because, I was really blessed to have some real wonderful opportunities. I know not everybody has that. Sure. So why am I keeping this information to myself? So as much as people want to listen or reach out to me, I try, even myself and Mia, we partnered together, did a little tag team to help mentor one of my interns, and she had the best of both worlds. She was doing policy work, but she also got to do social media work. So I just try to make sure I try to broaden people's horizon and be, as helpful as possible when I can.
So on a broader level, what, these are, I think anytime you say this, it's true, but these are tough times in terms of divisiveness and not really coming together, I think, for solution-based kind of moving forward. What advice do you have for the younger generations in terms of how to follow their dreams or find their North Star that you talk about, or paying it kind of forward as they move up based on what you've learned?
So I would tell people, one is, sometimes it's not linear, right? So sometimes you have different opportunities that you might have to take that might not be on the path that you think you're going. It might take you somewhere and it all ladders up, right? I just think the biggest thing is understanding your values and what's important to you, and that'll help you guide you. But also, three things I think young adults need to keep in mind as they, go on this journey, this career path is rejection and no is a normal part of life. Don't run from it, at all. Feedback, as we talked about, is a gift. So understand what that comes along with. But also, you always got to be your biggest fan, right? If you're not your biggest fan, you're not confident. Who else, right? So keep those three things in mind and just figure out really what's your North Star and your values. And I think from there, every decision, once you look through that lens, becomes easier and easier and easier as you get older.
Right. So do you think, are you surprised by because one of the things that we talked about in the pre-show and is important to you, is important to me, is kind of making sure that historically underrepresented people have access to the information, have access to people like you who are shining examples of what is possible. And you're just getting started, I could tell. So what is your thought about, and I, there's a lot of heat around DE&I and all that. So leaving that aside for a second and just talking about people who look like you and I, right? What advice do you have for them? You work in a big corporate culture. What do you think we can and should be doing that maybe mom, dad didn't teach us, life didn't teach us, but because you're in a successful corporate culture right now?
That's a really good question. That's a really good question. I would say I don't really have nothing right now that I can think about right now. Because for me, well, let me take a step back. What I think, let me lean into this a little bit more. What I think is vulnerability can be an asset, right? And that's something that even in our communities and stuff like that, we don't really lean into. And why I say vulnerability can be a real asset is even my experience at Pfizer, right? Just really quickly, is I was making a transition from the U.S. House of Reps at this time, and I had an opportunity to go to Taiwan on a sponsored trip. And in this particular trip, they were taking district staff, so you had to be a district director or a state director. We end up going to Taiwan, and I end up hitting it off immediately with a gentleman named Chuck from Senator Gardner's office. We hit it off, we was fast friends. And that same day, for some reason, we was having conversations about, where we want to go, and I explained to him, listen, with my career, my skill set, it has to be something highly regulated. I would love to go in pharma, don't know how to do it. Without hesitation, he made a recommendation to a gentleman named Albert Ribeiro, who recruited me and later being my boss. But for 2 years, we networked, nothing immediately happened. And on my birthday, I was taking off going to Sonoma, and he calls me, and he doesn't call me during the day. So I picked up immediately, and he goes, hey, there's a job becoming available. I think you'd be great at it. I would encourage you to apply. I quickly said, you got it. I get an interview.
Happy birthday.
You won't be let down. And I share that story is because if I didn't share, if I wouldn't allow myself to be vulnerable and say, this is what I need, can you help me? Who knows what would happen? Normally I would have kept that to myself, but we had some alcohol and stuff. I felt a little too,
No, but I think it's important. I think it's important to stretch.
Yeah.
I think it's important to put yourself out there. I think, sometimes depending on, like, I was raised in the Bronx in New York City, and it wasn't cool to be vulnerable or to ask too many questions, right? There was this air of like, it's so much better if you just act like you know. And so I think professionally, one of the things that I look for in the employees here and I look to cultivate in myself every day is coachability.
Yeah.
And it's like, no, I'd rather you be open to learn than thinking you know everything, because the more you learn, the more you don't know much at all, no matter who you are, right? So I think that's some of the advice I have for, younger people who might be looking to break into corporate, because I think that's an asset, right?
Absolutely. And also so one, that is definitely an asset. You definitely have to be coachable, right? Even at Pfizer, being a former athlete, like Pfizer just works well for me, right? Because we have this thing called straight talk, right? I'm not sensitive being an athlete, and it's not rude. It's in a way that to make sure we're aligned and we're all focused on the same goal, right?
Sure.
But to a certain degree, that comes with coachability and being able to take that feedback. And another addition I would say that young people should just keep in mind is your network, right? Your network becomes very valuable as you get older, depending on what you're trying to do. And like even now, even in LinkedIn, I have young adults that reach out to me all the time, and I try my best to meet everybody. I can't all the time. I try my best to help out, but one thing, everybody has different timelines. So some people are reaching out to me immediately because they're looking for an opportunity.
Okay.
Some people are just curious, but whatever it is, I just think that people have to be more mindful of social currency, right? Sometimes it makes more sense to build that relationship and stretch it out, because like even in my situation, it took 2 years, and at that time, I just thought I had a good friend, so you don't know what happens like that. So networking, always keep in mind what your social capital is. So
I think that's really important, right? At as well as my parents did.
Yeah.
There wasn't a conversation we had at the dinner table. Was your network is your net worth, right? Right. So these are things we have to learn either by furthering our education or by listening to smart people, but really kind of taking a proactive view, which it feels to me like has been the story of what you're doing.
Yeah, I mean, proactive, but also being proactive, but also like being proactive, you have these wonderful opportunities that you don't even think about, right? So I end up coaching, right? Coaching basketball, AAU basketball. It's not something I was thinking about, but my wife, the father of her child, Damon, he and I became really close, and he played professionally. And for me, everybody knows my North Star is giving back to the community. He has 12 young black men that he's coaching. He's doing things out of his pocket. I went to him, I was like, can I help out? And I think that was the best experience to me because it put me around athletics again. But like these young adults are like my kids. Like I love them. We keep in touch and being around the game. So it's like you have these wonderful experiences and these opportunities that you say yes to, and you don't know how they build up. Like I feel as though, because that experience, I'm a better leader.
Oh, sure.
From that experience. But also I feel like I was a better parent, a step parent, and able how to communicate. So just all these wonderful experiences I'm just so thankful for.
Yeah, I can kind of see it. And I think you are exemplifying kind of it kind of feels contradictory that the more you give, the more you get. And it feels super cliche, but the idea is like the more you serve, the more you're getting back.
Yes.
And I'm pretty sure that more than a few times in the future, these young men are going to reach out to you and tell you what you really meant, right? You might think you know, and you probably have no idea, which is so beautiful, right?
Well, you better be careful because, I want to I'll be a little teary-eyed thug.
I have a feeling that might be in your future, my friend. Yeah. I used to coach tennis, and I had one of my students who, I guess when I met him, he hadn't hit his growth spurt, so he was like 5'0", and I'm 5'0", and a few years later, I'm at the Bronx Tennis Classic, and I hear Miss Rivera, and I'm like, okay, so that's got to be one of my kids. So I turn around, and he's there with this guy. We're at the Bronx Tennis Classic. There's a lot of people that look like us, and there's my kid, and there's like big, white guy with a sweater vest, and I'm like, he's definitely not from like where I was working, NYJTL. I already knew that. But I looked at him, and I look at this kid, and he's like, hey, Miss Rivera. So I'm like, I can't place this kid. And he goes to his, I guess this is his coach, right? So he goes, this is my first coach. This is Miss Rivera. And I look at him like, oh my God, this kid's like 6'2" now. And he was like, I learned everything from her. He was like, it was a pleasure to meet you. I'm like, whoa. Like, you don't even know where something's going to take. This is a kid I taught in a free tennis program that Arthur Ashe started, actually, because he wanted to expose underrepresented cultures to tennis. And it was just so funny because you don't understand. That's the story he had. He was one of my students, right? But that's the story he had. So you also serve as a board member at the Central Connecticut, is that right? Yeah. For the YMCA there? Tell me a little bit about what you do there.
So, unfortunately, I just resigned off the board because I wasn't given as much time as I felt the board deserved and, the mission deserved. So I was a board member for the Alpha Community Service. So what that program is we provide housing for people that are almost homeless. We provide, upscaling skills for job and everything else. So it's a transitional facility for people and family, which is something that's really close to me. When I was young, that was the first place that really gave my grandfather an opportunity when he didn't have housing. I didn't know that we didn't have housing. Like, I thought we sleep in the car looking out the back was something cool, like we're camping out. But then I later realized that we had an issue, and the YWCA in New Haven ended up helping my grandfather out. Wow. So when I got older and I got positioned, doing politics in Bridgeport, someone who's like another mom to me, Carmen Colon, she was the executive director of this organization, and she goes, you should be on the board. We need some people that knows politics and know how, because for funding, but also I think you really appreciate it. But she never knew like how special that opportunity was to me. And even when I moved out of Connecticut, I was still on that board because it's so close to me. So, and the board is just amazing. You do amazing work. Even with some of the young adults, it's just awesome. And so yeah, I was very fortunate to be on that board and do some great work there.
I love it. What are your hopes for our industry? Switching gears a little bit.
I hope so. I'm going to take a little bit more of a policy lens. So one is, PBM reform, pharmacy benefit reform, management reform. We got close to that last year, at the federal government, not quite over the finish line. So I'm hoping we have an opportunity to get it done this year. And I would say the second thing, we got to lean in on health equity. I think we made some great progress, but I think there's a lot more that we can do, especially when it comes to like marginalized and rural communities. So those are my hopes that, we just stick to business and do the job and drown out the outside noise. We know what's important, so just stay focused. I would think that's my hope.
Yeah, that's really good hope. I like it. I like to end on something fun. Yeah. So what do you do for fun?
Well, so I told you I love basketball, did some coaching. So me and my wife, we watch a lot of basketball. Matter of fact, 2 weeks ago, I flew to Milwaukee to see one of my kids play. He's leading the nation in rebounding. So nice. Really awesome opportunity. He didn't tell me it was going to snow that day, but so I had on sneakers and whatever, but it was really good time. So we watch a lot of basketball, and actually that love ended up convincing me to go get my license, my certification to be an NBA agent, just thinking about that. So I just got the results on Friday, so I'm certified. So basketball was my hobby, but it might be a job later on down the road, so I got to find something else. So I really think I'm just going to get into golf now that my knees are better, and I get into golf and just do that. I was running away from it for so long, and my grandmother was just like, I don't know why you're not playing golf. You know you was playing with a kid and you didn't want to do it. So, Grandma, I am coming back.
I like
it. It's on. I'm going to beat you now.
And if you want to represent me in my basketball career, I mean, you might be broke, but that's really exciting.
Broken, happy, and lots of fun.
Broken, happy, and lots of fun. I love it. Well, I have to tell you, it's been such a joy sitting here and getting to know you and exposing our audience here on YouTube, Spotify, and everywhere else we appear on all the things. Oh, yeah, you're going to be everywhere. But the world should know about you. So I'm so happy you joined me. Thank you, thank you, thank you. And I look forward to hearing more about what you do.
Thank you so much. So nice meeting you.
Yes, and thank you for joining us today. I look forward to talking to you soon.